Welcome to Rabina 7-Day Doctors and Acupuncture Bulk Pill.
When I was a medical student, I flirted briefly with acupuncture. The thing is, I could never persuade myself it was anything more than placebo. These days, you can get it on the NHS. But does it work? And if you have, say, a bad back, should you give it a go? Well, A&E doctor Salia San has been investigating.
Like Michael, I've tended to think that the effects of acupuncture were all in the mind. But many doctors are now offering it as a serious alternative to painkillers. So I want to know, should we try acupuncture rather than simply popping pills? At this course in London, there's a huge variety of health professionals being trained in how to perform acupuncture as a medical treatment. Tell me what you do.
I'm a GP in Southampton.
What do you do?
I'm a sports physician, a sports doctor.
I'm an anaesthetist.
I'm a GP registrar.
I'm an osteopath. Obstetrician Dr. David Carr of University College London already uses medical acupuncture for pain relief.
Hi, sorry to interrupt. I'm Salia.
Hi, David.
Hi, David. Hi. What are you up to?
We're doing a little bit of lower back acupuncture, and this is one of the things we focus on this course, as
Right.
back pain's really very common, most common problem in the UK.
Healthcare professionals, doctors are a sceptical bunch. They're going to want to know how it works, why it works, what the data behind it is.
Well, since the 70s, there's been a lot of medical research into how this works, and there are many different ways, and not all of them will necessarily apply to every patient. But we certainly have local effects where we put the needles, we reduce tension, we have direct effects on pain. We also know that it releases endorphins into the spinal fluid, and that can be quite similar to taking a dose of codeine in some patients. It also affects the way the pain signals are processed through the body.
That's a lot of big claims. How is it possible that simply sticking needles in people can have effects like this? At the University of York's Neuroimaging Centre, one group of researchers has been trying to find out. They've been using a scanner to study what happens in the brain during acupuncture, and today they're going to scan me.
Here, this is Ross.
Because of the scanner's strong magnetic field, I have to take off anything metal, and our cameras can't come into the scanner room. But Dr. Hugh McPherson has acupuncture needles that won't be affected by the magnetism.
3, 2, 1, start.
He's going to perform acupuncture on me, and while he does it, Dr. Aziz Asghar will record my brain activity.
Stop. Well done, that's all finished.
So will acupuncture really produce an effect in my brain?
Hello.
Hugh, hi there. Now then. Hi.
Hi. How's it going?
We have results for you.
Oh my God, is that my face as well? Oh. I look like my dad. What are we looking at here?
You're seeing the deeper part of the brain.
Yeah.
And within that is something called the pain matrix.
Yeah.
And you would expect that if the needling was painful, you would expect to see a response there. So we'd expect to see lots of increases in blood flow. In fact, the exact opposites we're seeing here. We're seeing decreases in blood flow here.
The blue areas show where the blood flow has reduced when Hugh stuck needles in me. Less blood flow here may explain why we experience less pain during acupuncture. And these results are typical of what Hugh found when he conducted this kind of test in 17 volunteers.
The fact that we see decreases in blood flow here suggests that acupuncture is not a painful stimulus, it's something else. There's something about acupuncture that's causing the decreases in blood flow. What that is, we don't know.
So if I had back pain, just by looking at that picture, I would assume that it would have been an effective treatment.
This is the first solid evidence I've seen that acupuncture can have a measurable effect on pain levels. Although this study doesn't explain how it might reduce pain, at least it seems to provide objective evidence that it does. The evidence for some of the more established painkillers is often no stronger. And when acupuncture is carried out by a medical professional, the risks are very low. So now I understand why more doctors are prescribing it for pain relief in some cases. And I have to say that what I've seen has changed my mind. So,
If your doctor suggests using acupuncture for back pain, I would consider it.